Well, let's talk a little bit about the risk, benefits, and alternatives of your electronic records. Where I see the most vulnerable practices is when you're in a partial conversion. In other words, you're halfway through or you've just started converting to electronic records. There are areas where you may miss important documentation because somebody on the team thinks that it's gone to the electronic record, somebody else thinks it's already on the paper record, and guess what? It's nowhere. An office I worked with at the end of last year, the doctor was real proud of some changes they made. He goes, oh, I have a new hygienist. She's charting everything in the computer. I'm still using the paper records. It didn't make sense. How are they coordinating their visits for continuity of care, and how are they communicating? Is the doctor looking in the electronic record each time to be sure of what the hygienist has documented? Is she reading his paper record so she can see what transpired the last visit? That's where I see an area of vulnerability. So if you haven't gone paperless yet, please be aware of that when you're making the conversion. Of course, we talked about the advantages of being paperless already. So do you really think there's an alternative? No, we know this is where the future of healthcare is going to be. We're going to be interacting, we're going to be more integrative with multidisciplinary approach. And so there's really not much of an alternative. We need to be looking at the systems and softwares that are available and evaluating them to see which is best for your practice. The one thing you have to bear in mind is the GIGO principle. Garbage in, garbage out. So if you're not putting the information in correctly, you're not scanning and attaching it to the right patient, then you've got this electronic nightmare. So those are areas that you want to be very careful as you're making your conversions.